The functioning unit of the lungs is called the alveolus, and there are about 300 million in both lungs. If they were flattened out, they would cover an area of about 50 square meters, or about the size of a tennis court. The alveolus is where gas exchange takes place. Oxygen is breathed in and passes across a single-celled air sac and capillary and into the bloodstream. Carbon dioxide passes in the opposite direction and is breathed out. In a healthy alveolus, the shape of the air sac is round, and this shape is maintained by a chemical called surfactant that coats the alveolus. They also have elastic fibers that allow the alveoli to expand and contract to help air flow in and out of the lungs efficiently. Alveoli are clumped together in bunches like grapes. Emphysema is a type of chronic obstructive pulmonary disease that results in the destruction of certain lung tissues and permanent overinflation of the alveoli air sacs. The vast majority of cases are caused by the inhalation of irritants and toxins such as asbestos and most commonly by long-term smoking. These inhaled toxins cause chronic inflammation in the airways and will lead to permanent damage of the bronchioles, making them ineffective for allowing air to flow in and out of the lungs. The alveolar air sacs are also affected by the destruction of the elastic connective tissue that allows them to expand and contract to help air flow in and out. They lose their shape because the surfactant around their walls is also damaged. The walls between the alveolar sacs are also destroyed, and the alveolar lobes change their shape from looking like a bunch of grapes to looking like one large sac that has the effect of trapping air, and no gas exchange can occur. In about 5% of all emphysema cases, the alveoli are destroyed by a genetically inherited condition called alpha-1 antitrypsin or AAT deficiency. The body fails to regulate the balance of two types of enzymes, protease and antiprotease. Protease is found around the body and has the ability to destroy the elastic connective tissue in the lungs. Emphysema results in a buildup of trapped carbon dioxide in air sacs, and therefore more carbon dioxide remains in the blood. The body will then raise the respiration rate and depth to try and get rid of this excess carbon dioxide. These patients then have a ventilation perfusion mismatch, and the extra effort they have to make to get enough oxygen to their vital organs and expel this excess carbon dioxide has given them the nickname of pink puffers. Treatment relies upon management by medications. Here we'll discuss three main types of medications used: bronchodilators, inhaled steroids, and supplemental oxygen. Bronchodilators are medications that are used to help the airways open wider, letting more air move in and out of the lungs. They act on beta-2 receptors in the smooth muscle and mucous membrane in the lungs and the bronchioles. When beta-2 receptors are stimulated by adrenaline, the smooth muscle relaxes and the air passages open wider, allowing more air to flow in and out of the lungs. Bronchodilators are agonists of these receptors, which is why they are used to treat emphysema. This medication also acts on mast cells, which are important in the inflammatory response, by reducing their activity and the inflammation response in the air passages. Short-acting beta agonists such as salbutamol act to provide acute, immediate rescue relief from symptoms. They act within 30 minutes and last for about 4 to 6 hours. Longer-acting beta agonists such as tiotropium last for about 12 hours and are often used in conjunction with corticosteroids to provide additional control of symptoms. Steroids and other anti-inflammatory drugs work by reducing inflammation, swelling, and mucus production in the airways in the lungs. As a result, the airways are less inflamed, allowing easier passage of air in and out. Supplemental oxygen may be used if the patient's having more difficulty breathing. This is usually administered by nasal prongs and increases the concentration of the oxygen in the air going into the lungs. This will increase the amount of oxygen entering the bloodstream and help in the perfusion of tissues. Emphysema has no cure and usually progresses, causing the patient to radically change their lifestyle to adapt to the reality of having to rely on lower supply of oxygen to their tissues. Low oxygen or hypoxia means a lower amount of energy production in the cells and therefore increased fatigue and shortness of breath, usually upon exertion. Understanding the physiology of this condition and how the medications work is essential in the care of these patients. These patients need to be monitored closely to assess their overall condition and also treated holistically in terms of the activity level, risk of falls, living situation, and community support. The vast majority of emphysema cases are related to smoking, so finding a way to help them quit if they still smoke is very important in care management. If the symptoms can be well managed with medications, lifestyle can be maintained for longer.